Good morning, good evening, good afternoon, all depending upon where you're joining us from, and welcome you all to the session one of solving case studies for medical coding exam group study classes, or in other words, we simply call them as Tuesday night CPT group study class. So, coders, how are you all doing? And please do let me know, how do I sound? Is it good? Please let me know in the chat. Great, it's good and clear. Thank you for letting me know. So I know that you all have been eagerly waiting for this group study, and this one is going to be a special one. This one is going to be the last CPT group study for the year 2024 session. And thank you once again for joining with us for this group study. So let's not delay much, and myself, Sandeep, your instructor for the group study classes. The purpose of this group study is to review the scenarios, especially the long scenarios as well, that will prepare you for medical coding exam. So the steps to solve a medical coding exam case study for the board exam: you have to select the code that best matches your inventory. Yes, you are going to hear a lot about that particular thing in this group study session. So how to solve a multiple choice case study scenario for the board exam? Here at AMCI, we follow a few steps. One of them is to highlight the keywords. Definitely, you won't be able to highlight the keywords in the exam if you're taking, especially if you're taking an online exam, but you can take a note of these keywords. So for the group study, we use yellow for the diagnosis, green for the procedures, and pink for all the other inclusive procedures being performed. Document your inventory procedures and diagnosis. Then you have to select the principal diagnosis and principal procedure. Review your guidelines, select the code that best matches your inventory list. So while highlighting, please make a note that do not highlight the following things: the things which are observed by the physician, the closures such as sutures, staples, etc., hemostasis, which is also known as a bleed control, the drains, the irrigation of surgical site, installation and removal of the clamp and trocars, dressings, surgical risk. So make sure you don't highlight all those. So we have Mrs. J, our AMCI curricular director, with us, and that's me, Mr. Sandeep, your instructor for the Tuesday night group study. And we have our intern, Miss Katoya, who was supposed to join us today, but due to unforeseen circumstances, she is not here. So I will be having a look into your chat. I'll try to answer them, but I will respond to each one of your questions by looking into the chat. Okay, so please forgive us if you are not getting a response in the chat, but I am having look at all what you are saying in the chat. Okay, so please keep on asking questions and comment on the chat. I will respond as much as possible. Great. So let me start with the goals of the presentation for today. So for the today's class, we will be reviewing the integumentary scenario, the musculoskeletal scenario, respiratory scenarios as well. And yes, we will be solving all those case study. So we will begin with the integumentary system. So coders, are you all ready? Let me know the chat. So this is a group study. Let's make it interactive session. I want every one of you put your answers and interact with me in the chat. Okay, yes, ready. Okay, let's go for the first scenario. So I will read the question for you, following which you will have 2.5 minutes to 3 minutes to solve the case. Okay, let me read the question first. What CPT and ICD 10 cm codes are reported? Your options are option A 193160 with a 50 modifier and 64.82. Option B 19328 with a 50 modifier. All the ICDs are same and 64.82. Option C 19325 modifier. And option D 19340 with a 50 modifier. Your preoperative diagnosis is hypoplasia of the breast. Postoperative diagnosis also is the same. Operation or operative procedure performed bilateral augmentation mammoplasty, anesthesia general. Operative summary: the patient was brought to the operating room awake and placed in supine position where general anesthesia was induced without complication. Patient's chest was prepped and draped in usual sterile fashion. The patient had previous inframammary crease incisions on both the left and the right sides. The extent of the dissection would be sternal border within 2 finger breadth of clavicle and slightly beyond the anterior axillary line. Left breast was open first. An incision was made in the inframammary crease, going through the skin, subcutaneous tissue, down to the muscle fascia. Dissection at the subglandular level wasn't performed until adequate pocket was made according to the previous limits. After irrigation with a normal saline and careful hemostasis, a mentor and allergen silicone filled high profile textured implant was used and placed into the pocket. It was 300 cc. The skin was closed using 4-O vicryl in the interrupted fashion. For a deep subcutaneous tissue, 4-O monocryl in an interrupted fashion was used for a superficial subcutaneous tissue, and skin was closed using 4-O monocryl in a subcuticular fashion. The right breast was operated on very similar fashion. Implant was a 340 cc silicone gel, high profile textured implant from Allergan. Skin closure was the same. Both left and right breasts were very similar in size and shape. Patient had a bra applied. The patient tolerated this procedure well and left the operating room in a stable condition. So, what CPT and ICD codes are reported for this scenario? And coders, you have got 2.5 minutes to answer. I can see answers are coming in straight away. So great. So rest of you can take the time and I will see you when the clock stops. Okay, that is time, and I can see your answers in the chat. Great, great, great coding. Great way to start the study session as well. How about the rest of you people, coders? Give your best answers in. It's only me who's going to see your answers. Don't hesitate at all. You can give your best answers in the chat. And even if you're getting it wrong, don't worry. We are here to study, right? And we are definitely going to have a lot of aha moments in this 4 week of group study sessions. Okay, if you still working on it, please go ahead and place your answers in the chat while I walk you through the scenario. Okay, so let's start by following our steps. We first highlight the keywords. In this scenario, both the preoperative and postoperative diagnosis are the same. Why am I saying this? I'm saying this because there will be scenarios where you will see a different preoperative diagnosis from that of the postoperative diagnosis. So when you have a different preoperative and postoperative diagnosis, always go with the postoperative diagnosis, because that's what a surgeon or a physician confirms after performing the procedure. So always, if you have two different diagnoses in the preoperative and postoperative diagnosis part, go for the post-operative diagnosis. Well, we will see scenarios like that uh, in coming days, or maybe in coming slide as well. So just giving you all a heads up. So the post-operative diagnosis in the scenario is hypoplasia of the breast. Operative procedure, a bilateral augmentation mammoplasty has been performed. Patient was placed in supine position. General anesthesia was given. Incision was made in the inframammary crease. Dissection was performed. Adequate pocket, high profile textured implant placed into the pocket. Right breast was operated in a similar fashion as well. And the implant was silicone gel. Both left and right breast were in similar size and shape. So the correct answer, as most of you have said, is going to be option C. So great, great answers. And how did I got option C as a correct answer? So the second step is another important one. Get your procedure inventory and diagnosis inventory correct. So this is how we break down a complex or a long scenario or a case study scenario. So second step, you have to get your inventory ready. So we have in procedure inventory a bilateral augmentation mammoplasty performed, and in the diagnosis inventory I have a hypoplasia of the breast. So what is a breast hypoplasia? So I'll tell you what a hypoplasia of a breast is. It is a development of an inadequate breast tissue to meet an individual's expectations and adequate or desirable breast size. So uh, what the patients do is that they will undergo a breast augmentation mammoplasty, which is a surgery to increase the breast size, and it involves placing the breast implants under the breast tissue or the chest muscle. So you can see in the image which has been shown here, uh, different types of breast augmentation mammoplasty procedure performed based on where the breast implant has been placed. In first image, you can see a dual plane insertion. Second one, there is a subglandular insertion, and in the third one, there is a submuscular insertion as well. So just to show you all what the procedure is, I've showed up this image. And now let's come back to our coding portion, and let's select the best code that matches our inventory list. So in option A is coding for 19316, which is a mastopexy. So what is a mastopexy? It's a different procedure from breast augmentation mammoplasty. And a mastopexy, it is also known as a breast lift, and it refers to the skin reduction in order to remove or reduce or perform a reduction of underlying breast muscles to reorient the breast into a higher position. So that's not the procedure performed in our scenario. So I can eliminate option A. Now let's look at option B, 19328. And what it is coding for 19328, that's for a removal of intact breast implant. No, we didn't had any removal procedure. Cross checking with the procedure inventory, we didn't had any breast implant removal performed here. All we had is a augmentation mammoplasty. Right, so that is also incorrect. And option D, coding for 19340, which is for an insertion of breast implant on the same day as mastectomy. So yes, there was a breast implant which was placed, but did we had any mastectomy coders in this procedure? No, right? Exactly. So we didn't had any mastectomy procedure performed, and that is the reason why option D is incorrect. And the last remaining option, 19325. Now let's cross check with this. So procedure inventory, it's coding for a breast augmentation with an implant. Yes. So that is your correct answer because that's one which best matches your inventory list. So how are you all feeling, coders? Let me know. How are you feeling after the first scenario? Great, fine, good, awesome. Okay, great. Thank you for letting me know. So let's move on to the second scenario or second challenge. So you all did a great job here. Congratulations. So let's move on to the second one. Okay, this is a scenario two. So I would always prefer you to read the last portion of the question because that will give you an idea of to what to look for. So what CPT and ICD codes are reported for the scenario? Your options are option A, 12052 11642 with a 51 modifier, L85.8. All the ICDs are same. Yes. Option B, 12052 11442 with a 51 modifier, L85.8. Option C, 11442 L85.8. Option D, 12052 11422 with 51 modifier, L85.8. And this is your question. Preoperative diagnosis: rapidly enlarging suspicious lesion on patient's right side of forehead. Postoperative diagnosis: same. Operation performed: a wide local excision with intermediate closure of right side of forehead. Indication: the patient is 78-year-old white male who noticed within the last month or so rapidly enlarging suspicious lesion on right side of his forehead. Description of the procedure: the patient was placed in supine position on the table and was given no sedation. The area of his right forehead was draped and prepped with betadine paint in normal saline sterile fashion. The area to be excised was on the right side of patient's mid forehead. The lesion had maximum diameter of 1.1 centimeter with 3.3 centimeter margin. Designed for total resection of 1.7 centimeter. The area of excision was infiltrated with 1% lidocaine with epinephrine. Careful dissection of the lesion was carried down through the dermis into the subcutaneous tissue. After waiting for hemostasis, it was excised, tagged, and sent for pathology, permanent pathology. The wound was irrigated, several bleeders were cauterized. The defect was closed in multiple layers with 3-3-O vicryl and a running subcuticular stitch of 4-O vicryl and a few 5-O chromics. Total length of this closure was 3 centimeter. This was covered with steri-strips, adapted gauze, and tape. The patient tolerated the procedure with no complication and was sent home in a stable condition. The final diagnosis: right forehead wide local excision, keratoacanthoma, margins are free of tumor. So, coders, you have 2.5 minutes to solve this scenario, and your time begins right now. Once again, answers are coming already in. So, okay, this one is a tricky scenario. So, uh, heads up which I'll give you is to be little bit forensic. Okay, okay, gonna see you after the time. Okay, coders. I hope everyone plays your answers in, and let me walk you through this one. So definitely this one is going to be an aha moment scenario. So we have a wide local excision with intermediate closure of the right side of forehead. Patient was placed in a supine position, right side of the patient's mid forehead, 1.1 centimeter with 0.3 centimeter margin, designed for total resection of 1.7 centimeter. Good. And excised, tagged, and sent for permanent pathology. The defect was closed in multiple layers. Total length of the closure was 3 centimeter. And your diagnosis, final diagnosis, is keratoacanthoma. And the correct answer for this scenario is going to be option B. I know there will be questions raised. So let me explain you how did we solve this scenario. Okay, how did we get to option B as a correct answer? So the second step, get your inventories correct. So in the procedure inventory, I have an excision of lesion of the forehead performed, and this lesion is to be proven to be a keratoacanthoma, and we have 1.1 plus zero point 0.3 margins, and the total excised diameter here is going to be 1.7 centimeter, and an intermediate closure of 3 centimeter has been also performed. And in the diagnosis inventory, I do have keratoacanthoma, which was the final diagnosis by the doctor. And I would like to bring up this image. So coders, let me know, are you familiar with this diagram or this image? Have you seen it anywhere? Let me know in the chat. Yes, the excision chapter. Yeah, in the excision, right under the excision. So this will help you understand how an excised diameter or an excision diameter is measured for excision of the lesions. So you can see excised diameter will be the sum of a lesion diameter plus the margins. So what's a lesion diameter? It's the diameter of the lesion. So in this image, you can see the lesion diameter is 2.2 centimeter, and the margin is zero point 0.1 centimeter each on either side. So the total excised diameter would be the sum of this margin along with the excision diameter, or along with the lesion diameter. So we have 0.2 centimeter plus zero point 0.2 centimeter margins. So total, the excised diameter would be 0.4 centimeter. Okay, so is that concept clear, coders? Let me know in the chat. I just want to do a quick refresh on what you have learned in your week 1 integumentary chapter. So is the concept clear? Shall we move on? Okay, great. I can see only one yes in the chat. How about the rest of the students? To go, great. So let me move on to the next step, and let's select the best answers from the code options. Also, let's review some guidelines. So I have done a churning of my CPT manual, so you can see how easily I can get the correct answer with the help of churn. And also I have pulled up my FTRs for the integumentary chapter, the excisions topic. So under the excision, the first question you have to ask is it the excision performed for a benign or a malignant lesion? So keratoacanthoma is a benign lesion and not a malignant lesion. And also there is an easy trick to understand the CPT code that codes for a benign lesion and a malignant lesion. Do you know that? Okay, I will tell you. So the CPT codes which starts with 111, I'm sorry, 114 are the ones which are coding for excision of benign lesions. And the CPT codes which starts with 116 are those which codes for a malignant lesion. And knowing that we are coding for a benign lesion in this scenario, I can eliminate the wrong answers on site, not even without opening your CPT manual. So if I know the keratoconthoma is a benign lesion, straight away I would eliminate the options that is coding starting with 1116. So looking into the code options, I can see option A is coding for 11642, and that is for a benign lesion. I'm sorry, malignant lesion. So we are not looking at a malignant lesion here. We are looking for an excision of a benign lesion. Yes, exactly. I can see some of you have even put the FTRs in the chat. Yes, exactly. 114 is for benign and 116 is for malignant. Way to go. Excellent. So option A is incorrect because that's coding for a malignant lesion. Now let's move on to next option. Option D, it would be coding for 12052, which is, let me read the code language for you. Repair intermediate wound, face, ears, eyelids, nose, lips, and mucous membrane 2.6 centimeter to 5 centimeter. And yes, this one is a correct one because this one is exactly matching our procedure inventory. It's coding for a correct location, and size of the repair performed is also correct. So 12052 is a good option. Well, in option D, the second option 11422 is coding for excision of benign lesions, including the margins, except skin tag, scalp, neck, hand, feet, genitalia. Excised diameter would be 1 to 2 centimeters. So I can say this is an incorrect answer. You know why, coders? Do you know why, coders? Any idea why option D or the code 11422 is incorrect? Anyone? Yes, because this one is coding for a long rotation. Exactly, you are correct. Great answers in the chat. Yes, it is coding for a long rotation. So cross-check with our procedure inventory. We had an excision of a lesion performed on the forehead. So the code option 11422 is for scalp, neck, hand, feet, genitalia. No, they are not coding for a forehead. So option D is incorrect because of that. And now let's look at option C. So option C is also incorrect because reading our FTRs, it's clearly mentioned that for excision procedure, simple closures are bundled into the excision. The other closures should be coded separately. So we had an intermediate repair here, intermediate closure, which means an intermediate closure should also be coded in option C. Well, it's only coding for excision procedure. That's why option C is incorrect because that's not coding for an intermediate repair. So there you go. Option C is incorrect. And option B is coding for 12052, 11442 with the 51 modifier and L50A, L85.8, which is the correct answer. So also we have already said that 12052 is the correct answer. Now let's look at the next option, 11442, which is coding for excision of other benign lesions, including margin, except the skin tags, face, ear, eyelid, nose, lip, mucous membrane, and excise diameter is going to be 1 to 2 centimeters. So yes, cross-checking with our procedure inventory, excision of lesion of forehead performed. This one is also coding for excision of the lesions of the face. Forehead belongs to your face. So yes, 11422 442 is the correct answer. Okay, coders, let me know in the chat how was the scenario and how are you feeling?
Thanks for tuning in, and until next time, happy coding!